In the UK, for example, we have a really high vaccine uptake rate. More than 99% of the population have antibodies, and more than 90% have antibodies because they've been vaccinated. But what a turnaround, because if we were asking that question about 2 years ago, as we were going into lockdown for the first time and seeing stupendously high mortality rates, it was a very different picture. What we're seeing now is a population of people who have high levels of protection conferred by vaccine, but also conferred and reinforced by natural infection in many countries. But some countries have much patchier uptake of vaccines. They also have vaccines that appear to be less reliable and less resilient, and they know it. And the Chinese vaccines that have been used aren't as good as some of the other performers. And so there is some concern that they could see not just the rosy picture that you're painting, a lot of asymptomatic cases, they could see in certain sectors of society, particularly older people, higher levels of breakthrough, higher levels of severe disease, which is why I think they're being more cautious in this instance. But it is welcome news that the vast majority of people are seeing lower levels of symptomatology. They're being much more trivially infected.
Well, it's not a question of the efficacy here because you've had one of the lowest infection rates in the world. It really goes to the studies themselves. I always advocate that it's better to listen to science than anecdotal. And quite frankly, in Hong Kong, that was backed up by peer review. The Chinese vaccines actually have worked very well. Sinovac has been compared as equaling as the top mRNA in certain vectors. And remember, I was fascinated by Dr. Hazeltine's analysis. This is a pandemic that is evolving, and you have to evolve how you respond to it, not only in terms of the physical environment controlling the spread, but also in terms of the treatments. And the unfortunate part, which you didn't mention, is that by allowing people to walk around, even with these asymptomatic cases, you're in essence creating human petri dishes, which is going to allow more variants.